Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And I would love to welcome Dr. Andrea Austin and Dr. Stephanie Byerly. Thanks for joining us today, Andrea and Stephanie.
It's great to be here. Thank you.
Thank you. Awesome to be here.
Okay, you're welcome. It's great to have you. And by way of introduction, Dr. Andrea Austin is a leading emergency physician, simulation educator, advocate for physician well-being, and author. She's dedicated to inspiring more change makers in healthcare and is researching the individual and organizational factors that promote innovation, creativity, and problem solving in healthcare. And Andrea sent me her incredible book, and I dog-eared, as you can see, almost every page. And I feel like I could have a whole year's worth of book clubs, like talking about your book. It was really, really incredible. I can't recommend it highly enough. So thank you so much for sharing this beautiful work with me. And Stephanie, Dr. Stephanie Byerly, is a certified life, women's empowerment, trauma-informed leadership and professional coach, anesthesiologist, speaker, and author. Over the last several years, an additional focus of hers has been preventing physician burnout and promoting physician wellness after experiencing several episodes of burnout during her career. So I appreciate all the work that you're doing as well. So thank you so much for everything that you do, Stephanie.
Thank you.
And today we'll be talking about trauma-informed coaching and trauma-informed leadership. And this came up when Dr. Michael Hirsch sent me a link to the joint podcast that the two of you did, and he thought it would be great for me to have you on together. And here we are. So thank you, Michael.
Thank you, Dr. Austin, because she invited me to her podcast. So yeah, thank you. Yes.
That's terrific. It's a great circle of caring, right? And yes. What would you most like our audience to know about you as we begin our conversation? Feel free to include hobbies, whatever you want. Stephanie, would you like to go first?
Sure. What I would love to share is just that I am really dedicated to talking about trauma because of life experiences, but understanding how much impact it has and how much learning about it has changed my life. And I have a life now that I never imagined that I could, and really grateful for that. And new hobbies are traveling, and I am also kind of the crazy cat lady. So I have two cats that I love very much, but just experiencing life in a different way now that I'm really focusing on what it's my time.
I love that. Thank you. Andrea?
Oh, such a great question. I would like the audience to think about what they envision their life to be. If you go back to, I was just talking to a group of medical students, that day that you walk across the white coat stage and you're going into the profession of medicine. And when I talk to a lot of my colleagues, that vision is no longer there. They're so frustrated by the system. And one of my good friends who you've had a conversation with, Sheree Johnson, reminds us that while it's a bitter pill to swallow, the system is us. And there is real relief out there. And what Stephanie is going to share and what I'll share today, I hope there's, just a few pieces people can grab onto and understand that while the system is very complicated and is going to take a long time to change, there is real things you can do today to start feeling better.
Mm-hmm. I love that, and it's so true. And I asked Stephanie as we get started if she would share a bit about what an ACEs score means, and
Mhm.
to share a personal example how I can relate how that's important is there used to be the Ladies' Home Journal magazine had this feature, Can This Marriage Be Saved? So when I was like a teenager in my early 20s, I looked forward to it every month, and it was kind of like a he said, she said, therapist said, and whatever problem they were having, it always went back to childhood and childhood experiences and things that happened in their childhood. And I always remembered that. So as I've learned more, I recently had Dr. Casey Morton and Dr. Amy Loden Tiffany on, and they spoke to trauma and trauma informed care. And it made me think of that because some doctors might not realize the things they experience in childhood or medical training or attending really is trauma. You know, they might try to think, oh, well, it wasn't that bad, or I'm okay, or I'm physically okay, or something. But that's not true. It just lives inside of you. And Stephanie, if you would like to get us started and share a little bit.
Sure. The ACEs survey, as you said, a lot of people don't know about it. And really, it's looking back, it asks 10 questions. And if you have an ACEs score, they say of 4 or higher, you have a chance of having more chronic illnesses and actually may have a decreased life expectancy. But the thing that's important to know about it is it's not an absolute. So it doesn't mean if you have a score or this that you're at, you're definitely going to get these chronic diseases. But it's very indicative of how trauma lives in our nervous system and causes autoimmune diseases. And they're linking it, unprocessed trauma, to so many disease processes and inflammation, which is the root of many processes. And the ACEs score only goes through age 18. So that's how they studied the people who were, answering the questions. So obviously we know trauma doesn't stop once you're 18 years old. And when you really start to understand, it affects how you show up in every situation in your life and every conversation you have, and everything is filtered through the lens of having had trauma in your life. And especially with medical training, as you mentioned, we don't consider what we see or what we hear as trauma. But if you hear a story about, say, a patient, that is going to be processed as primary trauma as if it was happening to you and gets embedded into our nervous system. And the same if you are taking care of a patient who's traumatized, it's all the same. We process it as if it's happening to us. So, we're told we're not supposed to have feelings. We're supposed to just go take care of the next patient. But then when we don't understand we have to process what we're experiencing, it gets stuck in our body, and it's the residue of that that's really affecting us in so many ways.
For sure. And our audience is primarily physicians, but you can also say this is true for other healthcare workers. And I
Mm.
was 16 when I joined the ambulance corps, and my
Oh,
very
goodness.
first call was a CPR call. And
Mhm.
and we couldn't save. So here I was joined the ambulance corps to save somebody, and I couldn't save the very first person, right? But then you have to get back on the ambulance, and we had 2 more calls that night. So Andrea, of course, is an ER physician, and with your experiences in the military, is there anything specific you would like to share about doctors maybe not understanding the things that they've been through really are traumatic and how that they're showing up?
Yeah, I think what Stephanie said was so important that, a lot of times for physicians, the bar of what's considered trauma is so massively high. When you think about when they actually, in rare cases, will bring in a professional to debrief a team, it's generally something completely catastrophic. A child dying often is not enough to bring in a professional debriefer. That's viewed as routine. And when I was in residency, I had great teachers and very compassionate doctors around me, but they never provided any granular skills on what do you do after these traumatic events. It was simply, this is part of the work. This is what we do. Get back on the horse. And that worked for a long time until it didn't, like many things, right? And an analogy I really like for trauma is actually one borrowed from the acting community. And I heard this from Dr. Dan Dorcas, who works with mission critical teams. And essentially, when an actor takes on a role, sometimes they're playing very traumatic parts. They recognize that when they de-role, when they're done playing that role, they should do something to let that go. And I was just listening to a Sunday show, and this actor was actually talking about that he will sit in front of a mirror and he will cry and he will say goodbye to that character and thank that character for what it taught him, and how it's helping, his humanity. That may sound incredibly woo-woo to somebody listening right now, but what I think is important to take away, and what happened to me, is towards the end of the COVID-19 pandemic, there was just a day where I was just like, I don't think I can do this anymore. And it snuck up on me, slow and fast at the same time. And the analogy I use is that it was essentially like, if every time something bad happens, a patient dies, or you have to give a serious diagnosis, they're little cuts, right? And then one day you realize you have all these little cuts, or, if you had a vacuum cleaner and all of these little traumas were little poofs of dust coming up, suddenly you're covered in so much that it was just a little imperceptible amount for many years, but now you're caked in it. And I had to do something to remove it. And it took, quite a few pages of the book to describe the process. But I want to leave it there and see where you'd like to pick up next.
Sure. So Stephanie, would you like to share some examples from your own life?
Yeah, I would say currently, this really stuck out to me, and it's because I know a lot about trauma that I think this would stand out for a lot of physicians. It was a Christmas day, and one of my nurse anesthetists came to tell me a history of a patient, and we never took care of the patient. She didn't require our care. But this stuck with me for days, and I was ruminating about it, and I couldn't get over just hearing the story. I kept visualizing what this woman had been through, and I was very fortunate to be able to process it with the group that I work with, that are all trauma coaches. But just think about that. I knew what was going on, and I was traumatized just from hearing a story, never having seen the patient. And so it really has just a huge impact. But I didn't realize, as far as my life went, how much my trauma had affected me and how I was showing up. I didn't really understand trauma back when I went on my personal growth journey. There wasn't much about it. But what I realized was that I was very reactive, and it was because I had had so much trauma in my life that my nervous system was just at a very high level, vibrating all the time. And when you're an anesthesiologist, being reactive and anxious is not a great combination, and really had to figure out what was going on. This was about 25 years ago, and it was like, okay, I've got to figure this out. And I was really grateful to start learning about it, but really understand I'm not broken. There's no other way it really could have been after what I had experienced in my life from trauma. But that was a huge relief to find out there are ways to help you process it and embody safety back in your body.
Yeah, that's
Yeah.
beautiful and so well said. And I don't know if you'd each, because I know Andrea, in your book, you share some, personal example from your childhood or military, like things, if you were willing to give any personal examples of what could be considered trauma that doctors might not realize is trauma, again, because the bar is so high.
Right. Yeah. So one of the main traumas in my younger years is my mom is bipolar, and she required hospitalization the summer I was 12 years old, and she was hospitalized probably all told about 5 weeks. And I didn't get any therapy, or our family didn't get a lot of help around dealing with what was going on, and it was very taboo as well. So there was a lot of shame that she was hospitalized. And you can imagine, there was definitely some times that, given her illness, she wasn't really able to care for me as much as one would hope. And so that was, something that I thought I was over. And it was later, once I went to therapy after the pandemic, that my therapist started to link how I was experiencing some things and how I was coping to skills that I learned to get through that period. So, what we often learn is when you're trying to deal with something traumatic, the skills that you use to survive that are counterproductive later in life. And I can see Stephanie's head is shaking. And certainly, if you want to add something with your work.
When I did my trauma therapy, my EMDR, which changed my life, I similar to what you're speaking about, I realized I was making decisions about my kids' welfare. Like I was in the hospital when I was young, so it kind of got stuck at a 3 or 4 year old being in the hospital for a month. And I was so over focused on my daughter's health. Any little thing would freak me out because I didn't understand that I was actually making decisions back from that age when I was traumatized. And so really to start understanding that it goes back so far. And that now they know if a mom is being traumatized when she's pregnant at 4 weeks gestation, that's being baked into the baby's nervous system. And I know, my youngest daughter, has suffered the consequences of that for sure because of what I was going through and had been through. But when you start to understand this and really, again, understand that it's not anybody's fault, it just is, and that it's like a sense of relief, a weight can be lifted off your shoulders, that there is a way to deal with it when you start to understand. And I think for healthcare workers, and Andrea, you and I have had this discussion, but I think that there's really 4 reasons most of us go into healthcare, not all, but one, you were traumatized as a kid. Two, you were elevated to a caregiver, so you took care of adults as a kid, and you saw physicians or nurses, and you thought, "Wow, there are these wonderful people." You were, sick as a child, and that saw healthcare workers and thought they were these amazing, noble, altruistic people who took care of people the way you weren't being taken care of, or your voice was marginalized. And so going into a helping profession, you thought, I can help people and control their lives and nurture them the way that I wasn't. And I think if that's been your background when you go into medicine, you're sort of a setup because of the person that you are, in order to really be affected by these things. I mean, everybody would be affected, but to a deeper level.
Hmm. And Andrea, you can respond to anything Stephanie said, and also if you want to speak a bit to trauma-informed leadership. And Stephanie and I had a brief conversation about how everyone is showing up with their traumas and layering it on top of each other traumas and not realizing it, right? So if you're a leader and you have childhood traumas you've never processed, that affects the way you show up for your employees. So then you have employed physicians and other healthcare workers that are kind of on the receiving end of a leader who's trying to process their own trauma, but then doctors have their traumas and then they're seeing patients and everyone is interacting with everyone else's trauma.
Yeah, it's one big trauma loop. But I think, I didn't even know the term trauma informed leadership until probably about a year ago. So the good news is this is becoming more of a buzzword, which means we're going to be able to break more cycles. So Stephanie will speak more about this, but for somebody that's learning about trauma informed leadership, from my perspective, it's really about something my friend Dr. Josh Hartzell says, who would be a great guest to have on as well. In his book that's coming out soon on caring leadership, it's about caring. And, as a leader, there's going to be people that mess up. You're going to have employees, colleagues that do something that on the surface, you're like, what were they doing? What were they thinking? Why did they have that patient complaint? And a trauma-informed leader is going to have curiosity and assume that there might be more going on under the surface. And to anybody listening going, oh, come on now, we have to have accountability. There can be plenty of accountability. Accountability can look all sorts of different ways. It can be, we have to have a conversation about this. Or, wow, there sounds like there's a lot going on. And, we will need you to, get some help. there's a lot of different ways. But I'll leave it there and interested in what Stephanie wants to pick up on.
I would say one thing that really impacted me is Oprah Winfrey and Dr. Bruce Perry's book, What Happened to You? And I started reading that before I actually became a trauma coach, and it has stuck with me. He said, instead of looking at people and saying, what's wrong with them, could we say, what happened to them? And so when we look at people, we have to understand that there's so many different ways that trauma can show up, and it can be in this fight or flight responses that we all know about, and that may be aggression or anger, or it may show up in people as far as apathy or avoidance, having to do with the other ways they respond. And it may be that they're just, in these different trauma loops. But when we start to understand as a leader, we have to deal with our own traumas first, because hurt people, but heard people hear people, and healing people heal people. And so when leaders themselves can understand how they're showing up or what their immediate mindsets go to, it truly makes a difference. Because if we think about de-escalating a situation, if a leader comes to a situation that is very, very escalated, exactly what Dr. Austin is mentioning, if they can regulate their nervous system to come in a calm fashion and not get activated, we hear the word triggered, but what I've learned from my Lodestar colleagues, especially Dr. Kimia Saraf, is that we use the word activation instead of triggered. Triggered is so violent, but really what's happening is your nervous system's activated. So if you understand what's happening and you can calm your nervous system down before you go into a situation, it's limbic resonance, and you'll immediately de-escalate the situation. Now, we're not saying go into a dangerous situation and try to do that, but in a conversation, and just understanding that as the leader, you set the tone. And if you come in with maybe that, I wonder what happened to that person, instead of what's wrong with that person. And it just opens up humanity and empathy and curiosity and listening. And that changes everything. And communication going from but to yes and, so that you're understanding that you don't understand this person's lived experience. And just having someone communicate with you and connect with you, that's everything, because connection can mitigate trauma. And again, that comes from Lodestar Consulting and executive coaching, which they specialize in trauma-informed leadership. And it changes culture when leaders start to show up this way.
I love that in the way you say, instead of saying what's wrong with you or thinking it in your head, what happened to you, as far as leaders in their view of physicians, or physicians in their view of patients, and some of the things that they show up with, you could say like it's a reason, not an excuse, right? Understanding why that's not an excuse, but it's a reason, and taking it from that perspective. And Josh Hartzell has reached out to me, so we will be having a conversation. And also Kimia and Michael are going to come on,
Awesome.
Michael again, and Kimia in the future. So one thing this year, just talking, as I've learned more about, trauma informed, and the things that have happened to me and my work in this space, with physicians, is I really want to support them this year in that. And today I just published an episode with Dr. Adam Rosen. I don't know if either one of you are familiar with him. He's an orthopedic surgeon, and he shares his own personal mental health journey. He shared it in a YouTube episode. He just shared it, and just being honest and vulnerable, then it helps more doctors. I say every time a doctor shares their story, another doctor feels less alone. And his video where he shares his story has been viewed more than 1,000 times, and he's only received positive feedback. And also on the episode I shared today, the comments are only positive. So if you both want to even speak to, and I think especially there's even a hierarchy, like I think even people like surgeons or maybe ER doctors, like the ones that are in the top dogs or something, right, positions, it might be even more difficult, that they feel like they're going to be seen as weak. If Andrea and then Stephanie, if you want to speak to how we can support doctors.
Yeah. I think publishing my book was such a huge vulnerability exercise. And similar to what you're describing with this orthopedic surgeon, I haven't had any negative feedback. I mean, I'm sure, let enough years go by, somebody will say something.
Mhm.
Uh, but it's been overwhelmingly positive. And I think and the reason I'm so happy to be on your podcast is we need this connection between patients. And I know you're also a physical therapist, but you've had a lot of patient experience as well. And we need to bring down this hierarchy and humanize doctors, that we are people. The fact that residents today will be working a 24-hour shift, it's not
Mhm.
okay.
Mhm.
There's nothing different about how much sleep a physician needs compared
Mhm.
to an average person.
Mhm.
And, I think it's this perpetuation of trying to, make us into, the superhero persona is very unhelpful. And, I get it. Not everybody needs to publish a book that talks about things that happen in their childhood. But, find small connections, just small openings, very quickly. I'll just share with residents, what I'll do when they come into the simulation lab, I'll just ask them how their day is going, and do a 2-word check-in, something I learned from Brene Brown. And it's been fascinating, the words that they'll say. They'll say anxious, tired, scared. And then I'll follow up with, okay, what do people need right now? And usually they're like, I feel better just letting you know, and I'm ready to go ahead and start what we had planned today. But that's a very quick way to get people to start to open up and normalize that we're full humans, even doctors.
And Stephanie, as you respond, what Michael said in an episode that I had him on with Dr. Todd Otten, connection mitigates trauma. And
Mhm.
also, and doctors are so afraid of being seen as weak, but that seeking help is a sign of strength. So, anything you wanted to respond to that, what Andrea said, and to add in your own, how can we support doctors and how can we encourage them to seek help?
I think it's really important to understand too that women are affected in a different way than men, and the women are more burned out. The suicide rate for women physicians is much higher than it is for male physicians. The numbers are astronomical for both, but probably 4 times higher for women physicians. And there's reasons for that, but some of the most simple things like peer connection, people checking on each other, people realizing that it doesn't make you weak to ask for help to deal with the things that you're dealing with, because of the stress level. And we think about the way that physicians sometimes deal with this is drug abuse. And we're in the profession that I'm in, we have the highest risk of drug abuse as an anesthesiologist. And just to say, hey, I need some support today doesn't mean anything is wrong. Connection mitigates trauma, just listening, just sharing with someone, and also coaching. Coaching is amazing. Every physician, every human should have a coach, but every physician should have a coach, because we can't understand what's happening in our brain. And if we could have somebody be our guide to help us understand what's happening, then the layers of physician burnout really start to lift pretty quickly, and we can really start to deal with what is going on and how we can take care of our well-being. Because this doesn't just affect our professional life, it always leads into our personal life as well. And we've all worked too hard and sacrificed too much and are so dedicated to our careers to not be able to feel that we can connect with other people. Look, we need help too. We're humans, as Dr. Austin. We're just like everybody else. We've just chosen this profession where we pretty much sacrifice ourselves for others all the time. But it's
Mm-hmm.
time for us to take care of us.
Yeah, absolutely. And I am an ambassador for the Dr. Lorna Green Heroes Foundation. And I think, one of my own doctors took his own life, which is why I'm doing this work. And Dr. Joe Sherman was one of my first guests, and he said that on those questions where it says, have you sought, support for your mental health? The next question should be, and if not, why not? Speaking to exactly what you're saying, and that every doctor, every human could benefit from a coach. And Dr. Michael lawyers helped me process and accept a lot of things, you know, and I had some very poor experiences over the last few years, you know, at the hands of physicians. And
Mhm.
I couldn't be doing this work if he didn't support me and if I wasn't able to move forward. So, yeah. So, Andrea, what else would you like to say?
Hmm. I think echoing what Stephanie has said, Dr. Byerly, that, coaching is very important and there's a lot of different coaches out there. Coaching is future forward. And some of what we've talked about today involves trauma, which is retrospective. So I have a passage in my book about therapist or coach. And my take on it is it's an and situation. And so if
Mhm.
you're really struggling, if you're in a lot of pain right now, I would recommend getting both. And honestly, if you could you be more proactive and get help before you reach the bottom, because with anything, coaching or therapist, fit matters. There was one therapist I interacted with and it just wasn't good. It just wasn't a good fit. She didn't seem very interested in me or had any compassion towards kind of my experiences in the medical system. So, I had to find somebody else. So once if you've hit rock bottom, even just the exhaustion of like having to talk to different people and make appointments can be really stressful. So I think if you're even a little part of you is like, well, maybe I'm not quite optimized, maybe I'm not feeling really fulfilled right now, that would be the great time to look into therapy and coaching. And a good therapist, a question to ask them is, what's their take on coaching? I was very happy with my therapist that she was like, I think once we get some things addressed, that can be a great source of support for you going forward. So the two should really be adjunctive.
In about a year and a half, I did share uh, free and confidential resources for physicians, and also I had coaches. You know, they could put their coaching information out there, and I think about 50, 60 doctors did that. So maybe when I share this episode, I'll do that again. And so sometimes I've heard how doctors can feel lonely. You could be amidst people all day, but feel lonely. So Stephanie and then Andrea, if you, whatever you want to say as we start to wind down, if a doctor is feeling lonely, what do you suggest to them? And if they want to consider coaching or aren't sure, I know Physicians Anonymous is one thing, they can try to start with. What do you suggest?
Definitely, if they need therapy, there's also the physician assist line that's always available if people need to talk. Certainly, the suicide hotline if that's what's going on. Because as mentioned, coaching is not for any kind of acute processing of trauma or things from your past. And really, again, connection. If you need help, find someone. Think about if you were listening to a patient, what would you tell them to do? You tell them to go get help. So why would you not do the same for yourself? But we're all, fearful of that. But again, coaching is an amazing resource if that's something that you want to explore. And there's so many different coaches out there, different types of coaching, and you have to fit with a coach, just like as a therapist and as the physician that you pick. So really, explore it. Why not? I mean, look at people in the business world. They've had coaches. You get to a certain level in the business world, you automatically get a coach. It's not a choice. And if we think about all the athletes, they don't just have coaches on the football field. They have probably five other different types of coaches to help them on their journey. So just consider it. Why not?
Yeah, well, thank you. And Stephanie, how can our listeners get in touch with you?
My website is stephaniebyerly.com, and on all social media, it's at stephaniebyerlymd.com.
Okay,
Thank
thank you. And
you.
Andrea, do you have any take-home messages and how our listeners can get in touch with you?
I think pick one thing, take one step. If there was one thing we said today that was helpful, go do that. put on your own oxygen mask and take care of yourself. Your patients and your community and your family and your friends need you. And as far as connecting with me, my website is AndreaAustinMD.com, and I'm at Andrea Austin MD across all the socials. I'm most on LinkedIn and Instagram right now. And you can see my book behind me is Revitalized, a guidebook to following your healing heartline.
Okay, well, thank you very much. And I feel like there's a lot of us on LinkedIn, a lot of doctors, talking about these things that really do care and they're willing to be vulnerable and share their own stories to support their colleagues. So anyone seeing this, reach out to any of us and we can connect you, with resources. And I'll be sure to share, some resources when I share this episode. So thank you so much again for me being my guest. This is such important work, and that was a goal I had this year to be able to support physicians in, with their trauma work. Even though I'm not a coach, I can, share resources and direct, people to the right to people that can help them. So thank you both for the work that you do and for sharing your own stories.
Thank
And
you
thank
so much
you,
for what you
Kim.
do. Yeah, thank you.
Okay. You're welcome. So, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.